We together are part of a metamorphosis of an industry. The shift to value-based care is completely transforming how healthcare is delivered. Look, last year at Sea Life, you hear me speak about the industrialization of healthcare and the opportunity to eliminate a lot of waste through applying industrial principles. And the past year has only confirmed that trend. Okay, look at the stepped-up focus on outcomes. Okay, it's now predicted that by 2018, more than half of the Medicare payments are going to be function of one quality measure or another. The stepped-up focus on cost controls. Okay, in a recent HIMSS survey, 65% of providers named cost reduction as their #1 priority. Last year, I talked about airlines and networks. Okay, look at the M&A activity in the provider area. Okay, this industry is really starting to set itself up as networks. And then 2-3 weeks ago, a lot of articles in publications like the Wall Street Journal around stepped-up pressure on IT system interoperability to enable those networks. And I frankly think that's a good thing. Okay, it's the right thing for this industry to demand from your IT providers to be open and to be standards-based. And so when you all put it together, there's one word that stands out, it's value. Okay, we're all part of a healthcare big quest for value. Okay, and today, over the next days, my team and I will give you updates about what we at GE are doing to help you unlock value in your organizations. Okay, now value, we define it as improved patient outcomes delivered at the same or lower cost. Okay, and you need both. Just driving for cost cutting is going to result into bad patient outcomes. Okay, but just driving for the best possible care with no regard of cost is just economically unsustainable. Okay, so the trick is to do both. The trick is to drive real productivity and eliminate waste. Okay, eliminate waste by having the right diagnosis the first time, having the right clinician available at the right time for the patient. It's about the patient data traveling with the patient through the system. It's about keeping people out of the hospitals, and in the end, it's about billing and collecting for all the services that you deliver to the patients. Now, unlocking value in healthcare is about quality and cost. Okay, not just one, but both. Okay, and this will require real process redesign, which goes far beyond capturing quick fixes or cost-out actions. And that makes driving value in healthcare different and tougher than in other industries. Okay, if you would look at the automotive industry, you can focus there in driving cost out of your assembly line. Okay, drive cost out to drive productivity. Now in healthcare, you have to be more careful because your end user, the patient, is sitting on your production line. Your patient is part of your production process. Okay, so every cost action that you take needs to be balanced off with its impacts on the quality, the care quality for that patient. Now, healthcare has been focusing on unlocking value and the role of IT in that for quite a while. Okay, I would say the past 15, 20 years have focused on driving digitization, putting PACS systems and EMR systems in place. And while the industry today is starting to see the benefits of this digitization, okay, benefits in the form of fewer mistakes, fewer or faster billing times, better order entry, while we start seeing the benefits, the industry largely still today has still ended up creating digital silos of data. Silos of data that really don't deliver the new true insights yet. Okay, so today, we're only scratching the surface of what's possible with information technology in terms of driving productivity and value. It's really like, we built a car, we put a great engine in it, so we're moving now, but we're not clear yet to what destination and how. Okay, what this car needs at this point is a better dashboard, a GPS system, understanding how fast we go, what's our fuel consumption, what's ahead on the road, is there any construction or detours on the road. Okay, so today, it's all about taking your IT investment, okay, the big IT infrastructure investments that you've done, take it beyond digitization, into workflows and into analytics. Okay? And what you're going to see over the next 5 years is predictive and prescriptive analytics being added on top of your IT investment. Analytics that are designed to reduce variability, to eliminate waste in your networks, to connect information and make your workflows flow. Okay? I would say this is the true beginning of creating value in healthcare. Value in the form of cost and quality. And as you know, the value potential is huge. Okay? 30+% of what goes on in healthcare is often labeled as wasteful. Okay? For the US alone, that's $1.3 trillion of potential waste. Now, over the past years, we've gained a lot of insight into what's the nature of that waste and, more specifically, how and where can information technology, software, how and where can that help to unlock, eliminate that waste? And we found that in 25% or more of the cases, IT really can be that game changer. So we're looking at about $300 billion of potential waste elimination through applying information technology in the right ways. $300 billion, that is the size of the prize for all of us with the IT projects that we engage in. Now, 60% of all CFOs and radiologists today say they're quite happy with the inpatient EMRs that they have installed. Although they also see very significant gaps and missing capabilities that prevent them from fully realizing the returns on the massive IT investment that they've made. Okay, and it's gaps in the areas of enhancing diagnostic speed and confidence, connecting care pathways, enabling chronic disease management across the system, and improving the health system productivity or driving optimization of workforce. And so these areas are key to unlocking value in healthcare. And indeed, they have been and they are the premise for our GE Healthcare holistic portfolio of integrated care solutions, a portfolio that covers software, services, and partners. Now, we realize unlocking value takes a team. This is not just about technology. And so that's why we're building out a robust set of professional services and consulting capabilities to help you configure the software and to help you optimize your workflows to take advantage of that technology investment that you made. And to cater to your very diverse needs, we are building out our partner ecosystem. Okay? Partners that complement our capabilities and that complete for you the value equation. We have about 200 partners in our ecosystem today. Many of them you will be able to visit, to learn from, to get to know over the next days in the collaboration zone behind us. So look, in the past years, we in healthcare IT, we focused on developing great new capabilities and, more importantly, delivering proof points of unlocking value for our customers, for you. So let me take you through a couple and use it as examples to give you a flavor of where we're further developing. So first, I don't know if we do have any Canadians in the room today. Okay, but this is close to where you're from. This is Southwest Ontario Diagnostic Imaging Network, public-funded hub-and-spoke radiology network in the Ontario province, 62 hospitals across the province. Now, before, when a patient got referred from one hospital to another, the patient had to take their CD with their imaging with them, okay, which led to a situation where the other radiologist had no way to do any pre-diagnostics and no access to any prior imaging or prior information on that patient. Now, we worked with Ontario to consolidate all of their imaging in one vendor-neutral archive, central VNA, that's accessible from anywhere through a zero-footprint viewer. Plus, with our professional services, we help those 62 entities create consistent workflows across that network. And so today, doctors, radiologists, no matter where in that network, have a holistic view of the patient. It enables them to do multidisciplinary care teams and even to do remote consults in urgency cases like stroke. Outcomes have been tremendous, both on the clinical side and on the cost side. More than $2 million reduction in storage costs, 3% reduction in duplicative exams, and 100% reduction in CDs being carried and some of them being lost in the transition. So one great example of value unlocked, and we keep developing this type of solution. We launched this year a next version of our Centricity clinical archive. Okay? A vendor-neutral archive can be deployed on-site, in the cloud, in a private cloud. It supports the latest industry standards, and it includes a mobile image capture application that we jointly developed with UPMC, another great customer and partner in our ecosystem. And so look, talking about mobile image capture and mobile, this is really one area where healthcare has an opportunity to dramatically catch up on other industries. Okay, and that's around cloud. Okay, if I look at my 3 teenage kids today, with their cell phones, they collaborate, they share images, they share content, they share workflows way better than anybody else in healthcare. Okay? They are light years ahead of the healthcare industry just with their mobile phones. And so from a CIO perspective, the cloud absolutely does matter. But it also matters for you as a user, because cloud gives you unparalleled mobility, storage elasticity, computing power flexibility, and do this all at a lower cost and do it securely. Yeah, last year we launched our first true cloud application, okay, in image collaboration. This year we're extending that, we're bringing advanced visualization into the cloud, imaging analytics into the cloud. And that's really going to provide ubiquitous access and device-agnostic access to the powerful GE imaging analytics capabilities. Diagnostic is a huge driver of value, but definitely not the only one. Another big one is workforce productivity. The cost of labor is over 50% in any care setting. And today it is an asset that is not very well managed. Now, I learned a lot about workforce and specifically nurse productivity from my sister. Okay, my sister is a nurse. I see her a couple of times a year. And every time I see her, she is on my case. Okay, she called me Mr. IT Software. And then she hammers me on when is this software finally going to do something for them in terms of planning, avoiding those crazy overtimes, those crazy schedule changes, those crazy downtimes that really keep her from managing the mix between her family life and professional life. I'm going to see her again in a couple of months, and frankly, this time I'm looking forward to see her because I'm going to do the talking. I'm going to be talking about API workforce management. Okay, our latest part in the family acquisition we did a year ago of great workforce management, workforce optimization software. And so I'll be talking about what we are doing for Anderson Regional Medical Center. Okay. Prior, Anderson, like many of you, used the large pegboards with color-coded thumbtacks to assign nurses to shifts, all based on one data point, the midnight census, and no way to flex up or down during the day. Now, we deployed for Anderson a new automated system to do staff scheduling and measure time and attendance. And so today, chief nurse, with one single view, can plan her nurse workforce and update it if needed every 2 hours based on the census coming out of their Meditech EMR. In addition, she has visibility to the acuity needs, which allows her now to manage the ideal nurse-to-patient ratio. And the nurses themselves can log in remotely, pick their shifts, okay, giving them, again, control over that work-life balance. And the outcomes have just been outstanding. Okay, after 8 months of implementing the system, Anderson saw 6% of productivity improvement. Okay, that's equivalent to $2.5 million annual saving. Now, Anderson did 2 things with that saving. Okay, one, they shore up their P&L, but part of that, they translated into a salary adjustment, a market adjustment for all of their nurses. And that is really going beyond unlocking value and a true best practice. Now let's shift focus a little bit to a different part of the hospital, okay, the maternity ward. Okay, and in this case with Rockford Memorial, a 400-bed care hospital delivering 1,200 babies and serving northern Illinois. and southern Wisconsin. Now, Rockford has been a long-term customer of our Centricity perinatal for mother and child surveillance. And they had a big dilemma when they decided to implement a new Epic EMR. Okay, and the question was, are we going to replace or not? Are we going to replace that Centricity perinatal application or not? And the L&D nurses revolted. They wanted, and they succeeded in keeping the Centricity perinatal, okay, because this system, for them, translates into productivity. Okay, the way that in our Centricity perinatal you can annotate on the fetal strip really translates for them in up to an hour of documentation time saving per day. So we worked with Epic to ensure the seamless connectivity between the two systems. And today, Rockford is showing a 14% higher nurse satisfaction rate than the Epic national average. And it's really a great example of how we are investing to try to give you the best of both worlds and create true value around your EMR investment. And I would say the same is true for the ambulatory care setting. Okay, today, 35,000 of healthcare providers allow us, GE, to help them provide ambulatory care. And Amanusuk Community Health Services in New Hampshire is one great example. They are using our CPS system to keep chronic patients out of the hospital. Okay, they are a qualified health center. They are a patient-centered medical home. They serve 26 communities across 5 locations. And they decided to focus on driving outcomes for their diabetics cohort. So they're using great analytics inside of CPS to identify trends and manage their diabetic population. On top of that, we worked with them to configure specific workflows that prompt the clinician to have a conversation, to have the right conversation at the right time with their diabetic or pre-diabetic population, and helping them to change their behaviors. And again, great outcomes, okay, reduction of avoidable ER visits, or reduction of avoidable hospitalization of diabetic population by 20 and 30%. Now, ambulatory care, and I think some of you have heard me say that consistently over the past 2-3 years, ambulatory care is the quarterbacking function in healthcare. It's a huge lever to drive cost and quality across the system. It's a huge lever to keep people out of the hospital. And that's why we are continuing to invest in our ambulatory solutions. Today, we are in the early stages of building a next-generation ambulatory care solution. Okay? In fact, we are today driving the concept car on the track. Okay? It's a new solution that has a new information model that incorporates data from payers, from other providers, and from patients into one location. It uses new clinical rules and workflows to give each caregiver the relevant and holistic set of information on that specific patient that they have in front of them on that given day. And every ounce of care delivery activity is measured through a new set of analytics. Look, this next generation ambulatory EMR will sit at the intersection between population health management and care delivery. Okay, we're developing it together, side by side, with several of our customers that are here today in the room. We're leveraging our San Ramon Center of Excellence specifically for their user experience design capability, and we're leveraging modern cloud technologies. We're also taking care to develop it for easy migration. So when the time comes for you to move to this new system, we can do it with little overhead and little data transmission risk. So look, on the ambulatory space, we know that we owe you a great deal. And I'm personally excited about John Zimmerman and his team and what they are doing to progress our ambulatory care offering. Now, we touched population management. Okay, again, that's another big opportunity to unlock value at the healthcare system level. Our ultimate goal here is to provide insights that keep patients healthy and out of the hospital. Okay, and that's what Greenville is doing. They're a large not-for-profit hospital in Carolina, 11 hospitals, 1,800 physicians, 1 million patients under their umbrella. And they're working with Caradigm to execute their population health strategy. They're implementing Caradigm's care management, quality improvement, risk management solutions on top of the Caradigm intelligence platform. Okay, that really liberates all that data that today is locked up in multiple EMRs and other silos. They are going after 40% hospitalization reduction for chronically ill patients and 25% productivity improvement for their nurse care management. Okay, so again, tremendous value unlocked at this point, at the system level. Now, part of the shift to population management is a shift of fee-for-service to fee-for-value. Now, that shift is going to take a while. That's not going to happen tomorrow. Fee-for-service is not going to go away, but it will put now the burden on many of you to start managing multiple revenue models. Fee-for-service coupled with full capitation, performance bonuses, bundled payments, shared savings, and so on. And you do not have a lot of margin for error in managing those revenues. 50% of IDNs are losing money. The remainder are making razor-thin margins of 3% or even less. So that's why we keep enhancing our financial management solutions to enable you to get into the value-based payment world, manage that complexity, and unlock profitability. Some of you, over the next days, will further get to know our Denials IQ product, which is a new predictive analytic that we developed and that builds on the foundation of a new Centricity business release. It's a solution that proactively identifies claims that are likely to be denied. Proactively, so you have the chance to avoid these denied claims to hit the wall and result into a write-off. Okay, we're developing this together with 5 of our customers and with close collaboration with our GE research center up in Schenectady that has the patented exclusive algorithms that are behind that predictive analytics. And so look, these analytics are the kind of innovation that we will continue to put on top of our revenue cycle management solutions, to continue delivering you best-of-breed capability and performance. Okay, and that's what VCU has been doing with us over the past 20 years. Okay, VCU needs a very strong rev cycle solution to deal with all the complexities in their distributed organization. And on top of that, has to integrate tightly with their Cerner EMR. Over the past 20 years, we've worked closely with them to build on capability, to configure RCB, and it has led them to really operate at the true best practice level of cost to collect of 3.5 percentage points. Okay, 3/4 of the claims are clean, and so on and so on. Look, what all of these stories have in common is the use of data, and data to generate actionable insights. Actionable insights, it's what you need to then improve your processes and make better decisions. And so we believe so much in the power of analytics that roughly half of our development budget is going into expanding analytics and workflow capabilities into our products. So where is the other half of the R&D going? Well, into enabling technical capabilities like cloud and security, and to driving quality. And so when I stand here and talk about quality, I know very well that the road with us on this front has not always been smooth. And making that road smoother is my #1 priority. We've looked into root causes of some of the recent quality issues that we've had with some of our products, and many arise from integrating our products with your existing environments. So we're changing how we are designing our products. We're implementing a scaled agile framework methodology in our development teams. We're training our entire engineering force, our product managers, and our services on how to apply that. In a scaled agile framework, we start all of our development at the portfolio level, and we design for the ecosystem. And from a testing perspective, we have implemented new, broader factory acceptance test processes. And finally, we've augmented our service teams in the field with members of our own engineering teams to fix hot issues faster. On top of that, we continue to focus on interoperability, both from a technology perspective as well as from a standards perspective. And like many of you, as I was at HIMSS 2 weeks ago, okay, one of the key topics, again, at HIMSS was interoperability, but it allowed me to be part of some of the IHE meetings and to recognize a number of our GE employees that often are invisible to you. Okay, these are people, and that's why I showed you the picture, that on a daily basis help the industry move step by step towards standards-based interoperability. As GE, we've been a leader. We've been helping over the past to develop and implement standards like DICOM, like HL7, and today we are leading the way in designing the new fire standards for the industry. We are taking up our responsibility to enable data to flow across healthcare. When you say interoperability, okay, you get quickly into security. Okay? Security is top of mind for us. As a big GE company, we understand very well what is cyber risk. We know what it means to fight off on an annual basis millions of small and big attacks, spams, phishing attempts into an organization. And so we're working with the Predix platform, the GE-wide investments, to really build out security as a key component of that platform. We are leveraging the GE scale to develop excellence in cybersecurity, both in how we develop and deploy software, all with cybersecurity in mind. And we've brought on board external industry leaders from organizations like Microsoft, NSA, and Kaiser to bring us along. So look, finally, I want to share a couple of details around analytics. Okay, analytics truly is the foundation of how you turn data into value. Today, industry is very much focused on descriptive analytics that tell you what happened yesterday. Now, that's great to go after low-hanging fruits. It's great to change behaviors. But the future is really going to be about predictive analytics that tell you what is going to happen in time for you to take action and avoid waste. Or even further, prescriptive, that's going to help you figure out what actions to take. We are investing in analytics in 3 areas. Okay, we have developed a new analytics platform for all Centricity solutions. In the products, we're building out customizable KPIs, and we're building out new service offerings to help you configure, design new analytics that are unique to your organization. This new approach to analytics really will show up across every single Centricity solution across the portfolio, and it's already starting to make its way into customers. So look, in the end, it's our job to deliver you a quality product that's easy to use, that's fit for purpose, and that enables value to be unlocked in your organizations so that you can do your job, which is caring for the patients. I want to conclude my remarks today by saying again, thank you. Thank you for the trust that you've put in our teams. We are on a journey towards value-based healthcare together. It's about outcomes that we can deliver together, and therefore it's important that we partner. We partner with you so we can learn what outcomes truly matter for you. Thank you.